was always really interested in research, and I wanted to participate in research that really took the people who really matter into account and who would take the voices of people who the research will impact into the whole process of the research.
So I'm Nye Campbell. I'm a public and patient involvement professional working here at the School of Psychology within the University of Birmingham.
I'm Eva, and I'm a peer researcher and public involvement officer for the Mental Health Mission.
My name is Craig Mackey. I'm working on the Early Psychosis Informatics into Care EpiCare app.
So the EpiCare project is a project that seeks to improve treatments that are offered to people that are seeking support through the early intervention in psychosis services. EpiCare is a project that's been running for a few years now. In the earliest stages, we worked with experts by experience, collaborating alongside other key stakeholders like clinicians to look at what kind of things we wanted to do with the project, identifying what was of value to all members of the early intervention in psychosis community. Then more recently, we've been involving our lived experience advisory group in activities to support the development of an app that plays an integral part in improving services for people accessing support for early intervention psychosis.
I was interested in getting involved with this one using my lived experience because I use mental health apps myself. Some of them I've used and have actually been really helpful for me, and others I've used haven't been especially helpful. So I'm hoping being involved and putting this together from the start, it'll be helpful for the people that I'm also working with in the early intervention and psychosis services, and it will make doing some of the forms that you have to do a lot easier.
I've always been interested in research, so I started working for a charity that is partnered with the Mental Health Mission, and I'm interested in bringing my experiences and my position into helping to shape research. So within the mission, I work in the patient and public involvement team. So we've been creating some new safeguarding principles to make sure that PPIE work, patient and public involvement, is as safe as can be, and that we make sure to carry out the work in a way that means young people are protected and feel safe when they're bringing their lived experience into research projects.
Within my role, I can support public and patient involvement through several different tasks. Some of that is service user or expert by experience facing, so a lot of that will be communicating directly with our experts by experience, letting them know what to expect from meetings and what preparation is required, what remuneration is available, and also updates on the project as we go along. And then the other side of my role is working with our research team, so speaking to them about, as sessions are going forward, what do we want to get out of the session, what is a narrative that we're trying to drive in order to best position experts by experience to contribute meaningfully, and how are we going to demonstrate how we use their input in the actual design of the EpiCare project, and making sure that we capture feedback and do kind of like make sure that that's going around in a circle, that people are seeing how what they've inputted is having an impact on the project.
So I think my role as a peer researcher is really important because I think through the history of research there often hasn't been voices of the people who the research really matters to. And so having a role as a peer researcher allows me to bring all my identities into the research and come to the project as a voice that often is unrepresented. And I think it also allows a level of relatability because when you're doing patient and public work, it allows people to see you as a peer and not someone who's really daunting and scary to work with. So I think my peerness helps with bringing my personal experiences to the research, as well as helping the research process to be really comfortable and engaging for the people we're working with.
So involving experts by experience has been integral to all aspects of the project. In many instances, as researchers and clinicians, we've got ideas that we think are very well grounded in theory, but then the realities of that and how it works out in practice, that's where we need to involve experts by experience to kind of like verify that. For example, we've looked at some of the patient-reported outcome measures that we want to use within the app that will be used within the project, and being able to share some of these outcome measures with expert advisors and ask them how do we communicate the ask to them, and whether the measure is appropriate, how do we communicate what will be happening with the data, and being able to triangulate those decisions has made the whole process much slicker.
In designing the app, we've been asked questions about how we'd like the app to look, what colours we'd like it in, what information we would like on the app as well. So one of the bits that they're putting together for the app is sort of an introductory video and also introductory leaflets. We've asked how we'd like those laid out, the questions to be on them, and using sort of my lived experience. I know what it's like to be asked these questions. I can put it into a way that is more helpful for people.
So I'm also a part of the wider research team, and being a young voice in this team means that the researchers and the academics are able to take young voices more seriously and to bring a new and fresh perspective into the meetings, which often consists of people who've been doing research for many years. And also I think it's been really useful to take part in the meetings because it allows me to develop team building skills and networking with people and being a part of conversations that I haven't been previously.
So being involved in something that can help other people who are going through a similar thing to me is just amazing, because hopefully I can help change things for the better.